Hello dear students, welcome back to my YouTube channel Physiology Learning. So we are continuing with the gastrointestinal physiology. So this is the last video in the gastrointestinal physiology segment. So in this video we are going to discuss about the liver function test. In the previous video we have discussed about gastric and pancreatic function test. In this video we are going to check for the liver function test. So coming to the liver function test, it can be categorized into many different ways. One of the easiest ways is there are excretory functions of the liver that can be tested, or there are tests which can detect the hepatocellular injury, and there are tests which can detect the stasis also, that is cholestasis, test for cholestasis. And liver is going to produce some of the important proteins, so that can be tested via the synthetic functions. And finally, some of the detoxification and metabolic functions also can be tested. So these are the various functionalities of the liver which can be tested with various different tests. And liver, all of us know, it is one of the most important organ which works in various different ways. So these are the various different tests to test its functions. So let's get started. So first, the excretory function. The liver is going to produce one important substance, which is the bilirubin. So this serum bilirubin can be directly assessed. And the bilirubin test, when you do it, it will come in three different ways. One is the total bilirubin levels. Another one is called conjugated bilirubin level, which is also called direct bilirubin, and unconjugated levels, which is called indirect bilirubin levels. So I'm not going to tell you about what will happen in various different type of jaundice. Jaundice topic I wish to discuss in the hematology chapters. So there I will give extensive details about various different type of jaundice, what will happen to these bilirubin levels in different jaundice. So all those things we will discuss it there. So here we are going to discuss what are the tests available for testing the liver. Then next, urine bilirubin, it is actually not present in a normal person, but in diseases, in case of jaundice, it can be present in the urine. And urobilinogen is present in trace amounts. So they are present in trace amounts in normal individual. Again, in some disease condition, it is going to increase. Then we can also check for the serum bile acids levels directly. So these are the tests of excretory functions. Next, coming to the hepatocellular injury. So first years who are watching this, when you move to the second year immediately, you will find a lot of liver disease patients, and in them they will be constantly being tested for this hepatocellular injury. One is called as the alanine aminotransferase, which is also called ALT. Another one is called aspartate aminotransferase. Both are very, very important tests, but ALT is more sensitive and more specific to the liver. It is more specific to the liver. Whereas AST, it is produced by the liver also, as well as other tissues also, like cardiac tissue and other tissues also. So they used to put a ratio also. The AST is to ALT ratio. Whenever this ratio is less than 1, most of the time the patients will have viral hepatitis. And in case of alcoholics, what is going to happen is this AST levels are going to increase in case of alcoholics. Why it is increased in alcoholics is because it is a mitochondrial enzyme that is being released, and there is huge amount of mitochondrial damage in alcoholic liver disease patients. So this is going to increase. So if the ratio, again the AST is to ALT ratio, here the numerator is increasing. So when it goes beyond 2, it is most likely an alcoholic liver disease. So it is most likely an alcoholic liver disease. And coming to the test for cholestasis, there are two important enzymes. This also will be tested every now and then. One is called as alkaline phosphatase. Another one is called gamma glutamyl transferase. This is actually more specific for liver. Whereas this alkaline phosphatase, it is produced by the liver and bone. Suppose, for example, in a patient, if alkaline phosphatase is also increased and gamma glutamyl transferase is also increased, then it is most likely a liver disease, because both of them are indicated. But in some patients, if there is an increase in alkaline phosphatase but normal gamma glutamyl transferase, it is most likely a bone disorder. So in a liver disorder, both of them are increased. So this is one key area to remember. If both of them are increased, then we can suspect liver disease. Next, coming to the test of synthetic function. Most of the important proteins in the body are produced by the liver. So out of them, the serum albumin is important, serum globulin levels, both can be checked for the liver function, the synthetic function, and there is something called albumin globulin ratio also. So once you go on to their clinics, you will find out a lot of these being tested. And one important clotting thing they will test it, that is called prothrombin time and INR. INR is international normalized ratio. So this PT is nothing but prothrombin time. In the liver functions, I have told you the liver is going to produce important factors like 2, 7, 9, 10. So all of them are important for clotting factors. So if the liver is not functional, they are not going to be produced. So the prothrombin time is going to be deranged. So these are the tests for synthetic function. Next, coming to the test for detoxification and metabolic function, the liver has to detoxify some of the important toxins we say, that is the blood ammonia. So we can check directly the blood ammonia level, and liver can involve in gluconeogenesis and other process. So blood glucose levels can be tested, and the serum cholesterol level. These are all like an indirect indicator of test for detoxification and metabolic function. So these are the major tests for liver functions. I kept it short because for the first MBBS level, I am not going to discuss extensively on the various diseases. If you want further discussion on any of this, kindly drop it in the comment section. I'll be happy to make a new video. Thank you for watching. Stay tuned for more such videos. Thank you so much.